and welcome. This video will focus on which exercises a patient can do after a total knee replacement procedure. One of the important joints in the lower limb is the knee. The knee is important for daily activities such as standing, walking, and exercising. Diseases such as osteoarthritis and rheumatoid arthritis can lead to knee joint failure requiring surgical intervention. Candidates should fulfill the following criteria before the operation. 1. They should show evidence of knee damage on imaging studies such as X-rays. 2. They should suffer from moderate to severe pain that cannot be relieved by non-surgical methods tried over a long period of time. The contraindications for the surgery include 1. Active local or widespread infection. 2. Other medical conditions that put the patient at an increased risk for complications or death during or after the surgery. 3. A patient who suffers from severe disease affecting peripheral blood vessels or nerves. 4. The knee function should be decreased to such an extent that it affects their quality of life. Other indications include severe trauma or deformity to the knee in young individuals. The implant may wear off with time in younger patients, hence, patients have to limit their activities and avoid sports like football, basketball, and gymnastics. Knowledge of the anatomy of the knee joints is important and should be revised by healthcare professionals involved in the care of the patient. Early post-operative exercises. The following exercises will help increase circulation to the legs and feet, which is important for preventing blood clots. They will also help strengthen the muscles and improve knee movement. They may feel uncomfortable at first, but these exercises will help speed recovery and actually diminish post-operative pain. Quadriceps sets. Tighten the thigh muscles. Try to straighten the knee. Hold for 5 to 10 seconds. Repeat this exercise approximately 10 times during a 2-minute period. Rest 1 minute and then repeat. Continue until the thigh feels fatigued. Straight leg raises. Tighten the thigh muscles with the knee fully straightened on the bed. Lift the leg a few centimeters. Hold for 5 to 10 seconds. Slowly lower. Repeat until the thigh feels fatigued. Continue these exercises periodically until full strength returns to the thigh. Ankle pumps. Move the foot up and down rhythmically by contracting your calf and shin muscles. Perform this exercise for 2 to 3 minutes, 2 or 3 times an hour. Continue this exercise until ankle and lower leg swelling has subsided. Knee straightening exercises. Place a small rolled towel just above the heel so that the heel is not touching the bed. Tighten the thigh. Try to fully straighten the knee and to touch the back of the knee to the bed. Hold fully straightened for 5 to 10 seconds. Repeat until the thigh feels fatigued. Bed-supported knee bends. Slide the foot toward the buttocks, bending the knee and keeping the heel on the bed. Hold the knee in a maximally bent position for 5 to 10 seconds and then straighten. Repeat several times until the leg feels fatigued or until you can completely bend the knee. Sitting supported knee bends. While sitting at the bedside or in a chair with the thigh supported, place the foot behind the heel of the operated knee for support. Slowly bend the knee as far as you can. Hold the knee in position for 5 to 10 seconds. Repeat several times until the leg feels fatigued or until you can completely bend your knee. Walking. Proper walking is the best way to help knee recovery. At first, you will walk with a walker or crutches. Your surgeon or therapist will tell you how much weight to put on your leg. Stand comfortably and erect, with your weight evenly balanced on your walker or crutches. Advance your walker or crutches a short distance, then reach forward with your operated leg with your knee straightened so the heel of your foot touches the floor first. As you move forward, your knee and ankle will bend and your entire foot will rest evenly on the floor. When you can walk and stand for more than 10 minutes and your knee is strong enough so that you're not carrying any weight on your walker or crutches, often about 2 to 3 weeks after your surgery, you can begin using a single crutch or a cane. Hold the aid in the hand opposite the side of your surgery. You should not limp or lean away from your operated knee. Stair climbing and descending. Always lead up the stairs with your good knee and down the stairs with your operated knee. Remember, up with the good and down with the bad. You may want to have someone help you until you have regained most of your strength and mobility. Stair climbing is an excellent strengthening and endurance activity. Do not try to climb the stairs that are higher than the standard height, and always use a handrail for balance. Assisted knee bends. Lying on your back, place a folded towel over your operated knee and drop the towel to your foot. Bend your knee and apply gentle pressure through the towel to increase the bend. Hold for 5 to 10 seconds. Repeat several times until fatigued.